We're taking the baby to the vet because it's nail clipping time, isn't it? Every 3 weeks that we just have like standard appointment to get Twinkie's nails trimmed. Twinkie's quicks on her nails are really long. And I know a lot of you say like, oh my God, you need to like cut her nails. We do. Every 3 weeks, we take her to the vet. We just get it done professionally because Twinkie, she has a hard time. She's one of those dogs that has like massive anxiety over it. So it's just easier to do it like professionally.
Hi guys, how are you doing today? My name is Kidneyjay. The J stands for jerk because my kidneys are a pair of jerks, and this is an Amberlynn Reid video. We're just gonna jump into this one. It is called The Truth About Ozempic days 2/2-3 vlog. So let's start with this Twinkie Star. I wanted to leave this in because I love Twinkie. So cute. But she was talking about how Twinkie's quicks on her nails are long and how Twinkie gets anxiety every time they go to cut the nails. Well, I was told by my vet a long time ago how important it is to trim your pet's nails because the quick, if you don't trim it regularly, actually grows with the nail. Sometimes to the point where the quick is as long as the nail. You know when you clip your nail too short and you get that shooting pain, sometimes there's bleeding, and a whole bunch of swears come out of your mouth? That's what happens when you cut the quick of the nail of your pet. So of course Twinkie has massive anxiety about it. This is just like starting out. I don't know. The theme of this video is Amberlynn saying, look at this fire I started. Praise me for putting it out. And you'll see what I mean as we go forward. So, that's about the Twinkie thing. That's what I have to say about that. The good news is once you start trimming the nails again, the quick should recede. But it can take time to actually get the nail down to as short as you want because that quick could be, you could only trim it as short as the quick is, if that makes sense. Okay, she's also doing her 100 days of weighing in. By the way, guys, I am doing that. If you want to see me basically lose and gain the same 3 to 5 pounds between dialysis treatments,
Okay, guys.
by all means, tune in. I'm just doing like a short every day, just to show how easy it is. No secret, I weigh myself every day at dialysis. Tuesday, Thursday, Saturday, I'm weighed twice before treatment, after treatment. Not a big deal for me to weigh in. So not much of a challenge for me. Maybe the challenge is filming it. By the way, I know I'm going a mile a minute because this one is long, but I cut it down. The Twinkie part and the Ozempic part. Cut out all the nonsense in between. Leave a comment down below. I like hearing from you. Subscribe if you're new and hit the like button.
So I want to talk a little bit about Ozempic. I feel like in my live stream, I was kind of blindsided. I wanted to talk about it when I was ready. When I first started Ozempic, which is something my doctor recommended to me, when I went and saw my doctor, she actually had a few weight loss medicines that I could use, and I chose Ozempic out of like the 3 or 4 that she suggested because I had heard so many good things about Ozempic. She, obviously she knows.
So if she was given a choice of 3 or 4 or how many weight loss drugs, and Amberlynn chose this one that there could be a risk of gallstones, of pacreatitis. I don't know why her doctor let her choose that one. I'm also interested why, if she stopped it, why there wasn't a discussion to replace it.
My health and my health history, all my numbers, etc., etc. And I told her, I was diagnosed with gallstones almost a decade ago from rapid weight loss. I lost 89 pounds. I know those famous 89 lbs. I haven't talked about those in forever. I lost in 6 months. Rapid weight loss is considered 1 to 2 pounds a week over several weeks. If it's happening for months, rapid weight loss. And I had lost 89 pounds in 6 months. So I got gallstones from rapid weight loss.
Okay, so this is what I mean by starting fires and saying, look, how proud, aren't you proud? I put them out. So because she was overweight, she had to lose weight. And one of the unfortunate side effects, I guess, for her losing weight is possible gallstones. So that's great, you lost the weight and everything, but don't be saying it's not my fault because the original problem was your fault.
You know, my gallbladder was just under attack constantly. The pain was out of this world. It never got bad enough for me to get surgery. And I always found it so strange that it had to reach a certain stage before you got surgery because the pain was already just tearing me apart. Like, I would rock back and forth. I couldn't stop crying. Like, that type of pain is like, it takes away like functions of your brain when you're in that much pain. If you guys have had gallstone attacks and you know exactly what I'm talking about, I've never given birth. Anyways,
she was saying how a lot of people compare gallstone attacks to giving birth and how the pain is so much worse. I'm sure like gallstones are quite common. My sister had gallstones. I don't understand the pain part having to reach a certain threshold. Now, of course, our healthcare system here is different in Canada. What happened with my sister, and the doctor told her, you're getting these pains because a stone is most likely blocking a duct, and that's causing the pain. And what happens, we want to get those out because we don't want it to reach an emergency situation where that stone permanently blocks the duct, and then you're in big trouble. So I think maybe at the time Amberlynn Reid didn't have health insurance. That may have played a part in it. So I don't understand why surgery didn't happen and still isn't happening, because why would they wait for it to get at an emergency level?
I told my doctor, you know, because she knew about my gallstones and stuff, but she was like just asking me questions. She was like, do you show any more signs of it? Like, when's the last time you had an attack? And it made me realize, wow, I actually haven't had a gallstone attack. I've had maybe like 1 or 2 in the last 3+ years, which is crazy. So she was like, well, that means they could have gotten better, and et cetera, et cetera. And she was explaining how a lot of people have gallstones and they don't even know, and they don't even have symptoms and stuff. She was like, let's put you on Ozempic, and if you ever feel like you have any, you know, gallbladder problems, you need to tell me, and you're going to have to get off of it. And I said, okay. And she was like, have you ever had pancreas problems? And I said, unfortunately, yes. It was like 2 years after I found out I had gallstones, I got pancreatitis. She was like, okay.
So I guess what I've read, not a doctor, just what I've read, is the gallstone can block the duct to the pancreas, and that causes the pancreas to become inflamed. So again, I don't know if she had pancreatitis because of these stones. Why wasn't the gallbladder removed, or no plans for it to be removed, especially if she's doing her rapid weight loss again?
That's not good either. But I, you know, explained to her, like, I haven't felt any pain. It's been years. And, you know, I was just really motivated to, you know, try another weight loss technique, weight loss tool. And I was just really motivated and determined. It was something I really wanted to try. She trusted that I would tell her if I had any issues. And I did tell her. And it was around the same time that they noticed from my CT scans that I have sludge.
That's a coincidence.
In my gallbladder. So my doctor told me, okay, you need to stop taking Ozempic. And I had a moment where I was like, can we just give it one more chance? Can we wait until I'm in pain one more time? Because I did not want to stop Ozempic. I wanted to keep increasing my dose, and I wanted to see how it would do for me. And I just wanted to get to like the highest dose there was. Truly didn't want to let people down. That, you know, I don't know. I've also gotten questions of people saying like, what do you mean rapid weight loss? You didn't lose rapidly. And My doctor explained to me, which you can actually look it up and Google it as well, rapid weight loss is when you lose 1 to 2 pounds or more a week for weeks on end. And not only did I do that over a decade ago when I first started having gallbladder problems, but I also did that this last year.
By the way, I want to thank the person in the comments. A few video back on my another Amberlynn Reid video told me that like sludge is actually the term they use for what Amberlynn has in her gallbladder. Let's just keep going.
I was like 106 in like 12 months. I understand doctors aren't perfect. I have recently been misdiagnosed multiple times over the same issue, which is...
If I had a cricket sound effect, I'd put a cricket sound effect here. You know how I feel about the misdiagnoses is
quite unfortunate, but I know how I got gallstones because I was there. I did the damn thing. I did lose weight rapidly.
Again. So I don't know. Her way of thinking is I got gallstones because I lost weight rapidly. I would be thinking, and maybe I'm just, I don't know, too accountable. I'd be like, I got gallstones because I ate myself into morbid obesity, so I had to lose weight rapidly for my health, and that's why I got gallstones. Like, it's a different way of thinking, if that makes sense.
And gallstones also are triggered by yo-yo dieting and yo-yo, like losing weight, like losing, gaining, and you guys know that I definitely suffer from that. But yeah, it's been...
Suffer from it. I'm gonna start a yo-yo dieting charity, guys. Please donate. I'm a sufferer of yo-yo dieting.
So long since I've had, gallbladder pain, and
it's just so hyperbolic.
I was having it, and I had to tell my doctor because I want us to have that trust.
So, not accusing Amber of anything, but it's just very coincidental that the same time the results of the CT scan came back showing the sludge in her gallbladder was the same time she confessed and said she's having pain.
And as much as I wanted to continue Ozempic, it's just like, I know I need to just follow what the doctors are telling me to do at this point. And I didn't want to tell you guys yet because, I had to process it myself. And I was really, really upset about it. Like, genuinely, I actually cried about it because I was just like, damn. I mean, I waited till I got home. I was truly afraid to even tell you guys because so many of you weren't believing in me and you guys were placing bets on how long she was going to do it and when she was going to give up and all this stuff. And it's just upsetting, like so many people.
Well, because the best predictor of future behavior is past behavior. So that's why people not necessarily want to see you fail. I would love to see you succeed. I think other people would love to see you succeed. It's just based on what has happened time and time again. People are going to predict it's going to happen once again.
People expect me to fail because I have failed so many times, and it's just unfortunate that it's like my body is currently failing me without me even doing anything. Like, it's not my fault that I have lipodema. I feel like I'm having to explain myself so much, but lipodema is not a problem because I'm fat. Which is crazy because I feel like a lot of my issues have directly been because of my weight. Something else that people ask me is like, are you health at every size? Why don't you ever blame your weight for your problems? Ma'am, what? I am anti-health at every size, and I will always be anti-health at every size. And I do know that my weight plays a problem in a lot of my health problems.
So it is true, lipodema is not related to obesity, but, and she keeps glossing over this, her doctor did say she does have lymphoma in her leg, which is obesity related.
Also, back to the gallbladder. I did also get some comments about how you can get sludge in your gallbladder from high cholesterol. I know my doctor also told me that, and my cholesterol is actually normal. Like, I've never had problems with my cholesterol or anything like that, so
Good.
that's definitely not the thing. Like, I just feel like, oh my god, I just literally feel like I am constantly having to explain myself to people, and I hope that I will get better with that, maybe better with explaining myself and answering questions that frustrate me.
Okay, guys, so that's it for me. I'm just going to wrap this up here. The reason why Amberlynn stopped the Ozempic is because of her gallstones. Because she lost weight, because she needed to, because she was overweight. And that's it. I appreciate it if you made it this far. Thank you so much, and I'll talk to you later. Bye.